This is Jenny Guthrie at Glow Medical Aesthetics. I'm nurse practitioner and owner here, and today we're talking about one of my absolute favorite procedures. I say this about all the procedures because I love them all, but one of my favorite procedures is BroadBand Light by Sciton, or what we call BBL by Sciton. No, it's not Brazilian butt lift. I'm sorry to disappoint. We don't do those here at Glow, but BBL by Sciton was actually around, I think, before the Brazilian butt lift thing was around, so they have the corner on the market on the term. So when I say BBL, this is what we're talking about here. So what is it? It is a light-based procedure. It's not technically a laser, but it is a light-based procedure where we use different filters or different wavelengths of light on the skin, and we flash the light on the skin, and it hits a target. And so what are the targets that we're trying to treat? Well, redness in the skin, flushing, brown spots, dullness, little tiny facial vessels or the little telangiectasias on the face. We can treat those if they're small enough with the BBL. One of my favorite things about this technology is there's some really good science on it. There were studies done around 10 years ago on BBL that looked at several different factors. One of them was looked at the DNA in our skin cells. And the DNA, it basically tells our skin cells how to behave. Well, once our DNA of our skin cells has been exposed to UV damage, which Lord knows we've all had a bad sunburn as a kid. And once you've had that one nasty sunburn as a kid, you have permanently altered your DNA of your skin cells forever. I hate to be the bearer of bad news. I know it sounds really depressing, but we're here to talk about something that can empower you to do something about that. So once the DNA has been damaged, it begins behaving badly over time. And what is some of that bad behavior that we see with DNA? Well, it's crepey skin, the loss of collagen, brown spots, increased risk of skin cancers, and all of these things are what are precipitated by damage to the DNA. Well, this study that was done at Stanford showed that if you receive BBLs, it actually helps the DNA in your skin cells behave like younger DNA. That means it starts to repair itself. This is really powerful when we're wanting to talk about slowing some of the changes that occur in our skin over time. And so fixing the DNA is one of those. The other thing, they've done histology studies where they actually take a biopsy of the skin and they look at it under a microscope. And what they found is patients that received BBL treatments, at least 2 to 3, if not more per year, saw that their collagen structures on those histology slides started to look more like that of a 30-year-old. So if you were in your 40s and 50s, your collagen started to repair itself. And this is really, again, powerful when we're wanting to talk about taking care of our skin and slowing some of the aging changes that we all experience at some point in our lives. The other thing that they found, and they did this study for a very long time, 8 to 9 years, which in the aesthetic world is like a lifetime. It's a really long study. And the average age of the patients were in their late 40s, early 50s. And they had a control group that weren't receiving BBLs and a group that were receiving the BBLs. And basically what they found at the end of this 8 to 9 year study was that patients who were faithfully, again, with consistency over those whole 8 to 9 years receiving those treatments, when they compared their medical imaging there before the study and after the study, that they had aged not a whole lot, that their skin was holding and looking about the same age, versus the control group who wasn't receiving the BroadBand Light treatment. What they saw in that group was that they were aging at a normal trajectory. And so the only difference in the control group and the study group were the BBLs. They weren't doing any other aesthetic treatments. So we know specifically the power of this device, specifically Sciton's BBL. So at Glow Medical Aesthetic, we are thrilled to have the latest evolution of BroadBand Light by Sciton called BBL HEROic. And this stands for BroadBand Light, high energy, rapid output with intelligent control. And this basically means the volume of energy that we can deliver into your face in a quick amount of time with intelligent control, meaning safety, that you're getting a very consistent result over the curves of your face and the different parts of your face, because there are magnets in the handpiece and there's a boom that goes over that kind of sits over the patient that helps us know how quickly my hand is moving. With the moving of my hand, the device picks up the speed that my hand is moving to make sure that it adjusts. If I'm moving a little slower or I'm moving a little quicker, you get the same volume of energy with every pulse or every flash of light. It's really amazing, and it's state-of-the-art technology that Sciton has, and we're very proud to offer it to you, our loyal patients here at Glow Medical Aesthetics. So how do you prepare for your BBL procedure before coming in? Well, number one, you need to not be receiving spray tans for 2 weeks before your procedure. And even tanning drops or the slow over time tanning lotions that you buy over the counter and use at home, we also want you to discontinue that for 2 weeks in the area that you're gonna have treated. If you come in with spray tan on and you don't tell us, or we treat you with that on, we could indeed burn you. You're not going to get as good of a result. It's going to limit your results, number one, and number two, and most importantly, we absolutely don't want to be burning our patients. That is not good for you, and it's not good for us. So no self-tanner, please. We also want you to be out of the sun for 2 weeks before your procedure. Now, normal, like I'm walking to my car from work or those kind of things is fine. But if you're gonna be going to the lake for 8 hours, or you're going on a sunny vacation, or you're going skiing in the mountains, or you're laying out by your pool every evening after work, those kind of things, we want you to avoid it for 2 weeks. So this procedure, we have to be mindful of your sun exposure rolling into it, and that's really important. So that way we can actually deliver you the most energy, the most effective treatment, and the safest treatment to your skin. The other thing to consider is if you're a little bit darker skin type, or your skin has the ability to tan or hold a tan well, we may recommend that you use a topical serum that makes your melanocytes, which are the cells that make pigment in your skin, that makes them just a little bit lazy. Certain skin types, when we do a heat-based procedure on them, the melanocytes can get a little bit hyper-responsive to the procedure, and that's just something that we need to take into account. So certain individuals and patients, we may recommend that you add an additional serum to your regimen to make sure that you receive the best results with this procedure. When you come into the office, we're going to have you wash your face and take off any makeup that you have. We're going to do medical imaging, and we're also going to do our Visia skin analysis. And this device, again, looks very specifically at your skin. It actually counts your pores. It looks at fine lines, wrinkles, red areas, vascular areas, brown spots, UV damage, all of those things, and it gives us basically a number or percentage, and we can actually track your progress over time using this device. Once you've had your medical imaging done, you've completed your paperwork, you'll be taken back to the treatment room where we're going to have you change into a wrap, so be prepared for that, because we're going to be using a lot of ultrasound gel with this procedure, and it could get all of your clothes and be kind of messy. In fact, I usually wind up wearing about half the ultrasound gel by the time the procedure's over. So we want to be mindful of your fabulous clothes that you're wearing when you come in, and so we'll put you in a wrap. This procedure does not require numbing. In fact, we prefer not to numb. It's really not painful. And if it is feeling too uncomfortable, we need to know it, because that means we probably need to adjust our settings a little bit. And if we put topical numbing on your face, then we might blunt some of that response, and we could actually overtreat you or run the risk of that a little bit. So we recommend not numbing. If you're having any kind of significant discomfort with certain parts of this procedure, we can use the chiller device. When we're doing the skin tight procedure, which is the one that helps with tightening of the skin with the BBL, we can't use the chiller for that, because the whole purpose of that is to heat the skin up. So if we use the chiller with that one, it will negate the whole result we're trying to give you. But the chiller can be used in certain individuals in certain areas if need be, so that way we can keep you as absolutely comfortable as possible. Once you're done with your procedure, we'll apply SPF to certain skin types. Some skin types we might not recommend putting SPF on immediately. So just plan accordingly for that. And then we'll let you get dressed and check out and head on with your day. So areas that we can treat with BBL, of course, are the face and neck. And here at Glow Medical Aesthetics, when you purchase a face series, it is going to already include your neck. We always treat those two areas together. They're very important. The neck ages faster than the face in a different way. So it is vital that we stay on top of treating the neck as much as we're treating the face. So down the road, there's not a mismatch between your neck and your face, where your neck ages you and your face doesn't. That's really important to kind of think ahead about. We can also treat the décolleté, arms, legs. We can pretty much treat your back, your whole body with this procedure, which is really fabulous because most of us have had really bad sunburns on our back, and we want to treat these areas, and BBL is a very quick way to do it. And since we have the BBL HEROic device, this procedure is so much faster than the older IPL procedures where we had to stamp, and it took forever for both you and for the provider, and we were all exhausted by the time the procedure was over. With BBL HEROic, we can treat your back very quickly, and so from that standpoint, you won't be in the office all day having this area treated. The length of time that you'll be here is dependent on the area. For face and neck, I'd plan on being here about an hour. If we're adding décolleté, we might add another 15 minutes to that appointment. If we're doing larger body areas like arms and legs, which we can do since we're not using numbing, we can do all these areas at one time. You just have to, we would do that on a case-by-case basis. And for a back, if we're just doing back, probably be here for about an hour. If we're adding arms to that, we'd probably be here an additional 30 minutes for that area as well. So you can discuss that with our front desk staff or your provider to help schedule your day around the areas you're going to have treated. So other questions that we receive is, what all can we do with this BBL device that you have that is the Bentley of lasers, as you say? Because that's what we say about this device, is you're getting the absolute best thing that's available on the market. So there's different adapters and filters that we have with this device. As I mentioned before, there's a skin tightening one. And our BBL procedures do get complementary skin tightening in one area with this. But if you wanted to do just skin tightening as a standalone procedure, you can do that. We also have Forever Clear, which is designed specifically for acne patients. We have Forever Bare, which is the filters that are designed for hair reduction on the body. So we can do hair reduction anywhere on the body with different skin types. Also with the BBL HEROic, we can do a skin smoothing step, which is really fabulous. This is just getting more energy into your skin to really help with stimulating collagen and elastin and helping with luminosity and texture of the skin. We're always asked about the cost of this procedure. And so this procedure, there's lots of ways that you can receive it. You can buy it as an individual standalone procedure, which is really not what we recommend. It's not optimal because we recommend a series of treatments, especially if there's something clinical that we're treating or we're cleaning up or you've not received these procedures before, you will need at least 3 of them. If you have really terrible photo damage or sun damage, you may need more than 3. But again, your provider can do that in consultation with you when we're determining what's going to give you the results that you're desiring. We have membership packages available for 4 per year, which is what we recommend in the maintenance sessions because you'll space those out quarterly, spring, summer, fall, winter. And so you're not doing them as close together because you're in more of a maintenance mode. You can do them at the same time that you come in for your Botox visit. We would just plan accordingly. We would do your BBL first, and then followed by your Botox, and that would be your treatment for that day. We also have signature packages that include the BBL procedure in combination with filler, or we have packages where you can just buy the BBL procedures in a series of 3 and receive a little bit of a price break by purchasing that way. So another question I get asked is, can I do the BBL with other procedures while I'm at Glow Medical Aesthetics? And the answer is an emphatic, yes, you sure can. We just need to kind of plan ahead depending on what those procedures are. You can do BBL in combination with microneedling. We can do it in combination with MOXI, which is one of my favorite combinations, is the BBL MOXI combo. It is just anything that we can do to put more heat in the skin in one setting and one procedure is just going to deliver a much more better, quicker result for you. We can do it in combination with Botox or filler. Again, we just have to have the order that we're going to do these things in. We prefer to do the BBL first and then do the Botox and the filler afterwards. But absolutely, you can do it in combination with a Diamond Glow. So the sky's the kind of the limit with how we can structure this for you. But you can do multiple procedures in one day. We can just plan ahead. So post-care considerations with your BBL. Number one, avoid the sun for about 2 weeks afterwards. So don't come in and get your BBL and then get on a plane and head straight to Mexico following your procedure. That is a bad idea. Also, don't come in and do your BBL on a Friday and go to a pool party on Saturday. Again, it's a bad idea. You're going to compromise your results and you could have problems. And you're investing all of your hard-earned money into your skin. Let's protect your investment and do your due diligence and take excellent care of it after the fact. So you'll need to avoid direct sun exposure for any extended period of time for 2 weeks following your BBL procedure. Now, walking to your car and going in and out and about running errands is completely fine, but we do also ask that you wear SPF diligently. You must be wearing SPF every day for the sake of wearing SPF for 2 weeks before your procedure and 2 weeks after. And in fact, it's just a lifestyle habit that we recommend you get into, and you just wear SPF every day. I always tell people I'd rather you not wear underwear and wear your SPF. I don't want your face going commando. You can go commando, but not your face. So wear your SPF, it protects your investment. If you come in and you're not using SPF, we will actually not perform your procedure because we want to take care of you and we want to do right by you and we want to operate with integrity. There's not really a specific post-care kit that you'll need following the BroadBand Light procedure. We may ask that you not use anything really strong or abrasive on your skin for a few days following it, but you can resume your normal skincare routine following the procedure without any specific post-care kit. Depending on your Fitzpatrick type or how your skin tans or holds a tan, there might be a serum that we recommend you use that makes your melanocytes a little bit lazy so you're not hyper responsive to the sun following your BroadBand Light procedure.